Hello everyone, and welcome to our channel. Today's video is an important and highly informative educational presentation focusing on a sexually transmitted infection that is rapidly gaining attention worldwide, yet remains largely unknown to the general public. The infection we are discussing today is Mycoplasma Genitalium. Before we begin, I kindly ask you to subscribe to our YouTube channel. Our channel is dedicated to providing accurate, research-based educational content on health, disease awareness, medical science, and global public health issues. By subscribing, you help us spread reliable information, increase awareness, and protect communities through knowledge. Please subscribe, like this video, and turn on notifications so you never miss our future educational content. Now, let us begin. What is Mycoplasma Genitalium? Basic introduction. Mycoplasma Genitalium, often abbreviated as M. genitalium or MG, is a sexually transmitted bacterial infection that affects the urogenital tract in both men and women. It was once considered rare, but modern research shows that it is one of the most common emerging sexually transmitted infections worldwide. Unlike many other bacteria, Mycoplasma genitalium is extremely small and lacks a cell wall, which makes it difficult to detect and treat. Because of this unique structure, many standard antibiotics used for other bacterial infections are ineffective against it. One of the most concerning aspects of Mycoplasma genitalium is that it often causes no symptoms, allowing it to spread silently while causing long-term complications if left untreated. Historical background of Mycoplasma genitalium. The history of Mycoplasma genitalium is relatively recent compared to other sexually transmitted infections. The bacterium was first identified in 1981 by researchers Jørgen Jensen and colleagues in Denmark. At the time, it was isolated from patients suffering from non-gonococcal urethritis, a condition characterized by inflammation of the urethra not caused by gonorrhea. For many years after its discovery, Mycoplasma genitalium remained poorly understood due to limitations in diagnostic technology. Traditional laboratory culture methods were ineffective because the organism grows very slowly and requires specialized conditions. It was only in the early 2000s, with the development of molecular diagnostic techniques such as PCR testing, that scientists fully recognized the true prevalence and clinical importance of Mycoplasma genitalium. Today, it is officially recognized by global health authorities as a significant sexually transmitted pathogen and a growing public health concern. The bacterium, unique biological features. Mycoplasma genitalium is unique among bacteria because it has no cell wall. It has one of the smallest genomes of any free-living organism. It attaches directly to human epithelial cells. These characteristics make it difficult to detect, resistant to many antibiotics, capable of long-term infection. Its lack of a cell wall means that antibiotics such as penicillin and cephalosporins are completely ineffective against it. How Mycoplasma genitalium spreads, modes of transmission. Mycoplasma genitalium is transmitted primarily through sexual contact. The main routes of transmission include unprotected vaginal intercourse, unprotected anal intercourse, genital-to-genital contact. Current evidence suggests that oral transmission is less common but still possible. The infection spreads easily because many infected individuals have no symptoms. Routine STI screening does not always include MG testing. People may unknowingly transmit the infection to multiple partners. It is important to note that Mycoplasma genitalium does not spread through casual contact, does not spread through toilet seats, does not spread through sharing food or clothing. Symptoms of Mycoplasma genitalium. In men, urethral discharge, burning or pain during urination, urethral irritation or itching, testicular discomfort rare. In women, abnormal vaginal discharge, pelvic pain, pain during sexual intercourse, bleeding between periods, cervical inflammation. Asymptomatic cases. A large percentage of both men and women experience no symptoms, which increases the risk of delayed diagnosis and complications. Complications and long-term health risks. If left untreated, Mycoplasma genitalium can cause serious health problems. In women, pelvic inflammatory disease (PID), chronic pelvic pain, infertility, increased risk of ectopic pregnancy. In men, persistent urethritis, possible prostate involvement. In both genders, increased risk of acquiring or transmitting HIV, recurrent infections due to antibiotic resistance. Antibiotic resistance, a major global concern. One of the most serious issues surrounding Mycoplasma genitalium is antibiotic resistance. Over time, the bacterium has developed resistance to
azithromycin, other macrolide antibiotics. This makes treatment increasingly difficult and highlights the importance of accurate diagnosis, proper antibiotic use, following medical guidance strictly. Global prevalence, countries and regions affected. Mycoplasma genitalium is found worldwide. Studies show significant prevalence in North America, Europe, Australia, East and Southeast Asia, Sub-Saharan Africa. In many countries, prevalence rates are similar to or even higher than chlamydia in certain populations. The global spread is linked to limited testing availability, lack of awareness, antibiotic misuse. Diagnosis and testing. Diagnosis is done through nucleic acid amplification tests, NATs, PCR-based testing of urine or genital swabs. Routine STI panels may not include MG testing, so specific testing must often be requested. Treatment and medical management. Treatment depends on antibiotic sensitivity. Common treatment strategies include common antibiotic therapy, resistance-guided treatment where available. Patients must complete the full course of medication, avoid sexual contact during treatment, ensure all partners are tested and treated. How to prevent Mycoplasma genitalium. Prevention strategies include consistent and correct condom use, limiting number of sexual partners, regular STI testing, open communication with partners, avoiding self-medication with antibiotics, personal protection and sexual health responsibility. Protecting yourself means staying informed, seeking medical advice early, avoiding stigma and shame, practicing responsible sexual behavior. Awareness leads to early detection. Early detection leads to effective treatment. Social awareness and public health importance. Mycoplasma genitalium highlights the need for updated STI screening policies, improved public awareness, responsible antibiotic use. Ignoring emerging infections can create future global health crises. Why awareness matters more than ever. In a world of increasing antibiotic resistance, infections like Mycoplasma genitalium represent a serious warning sign. Education is the strongest defense. Final message and strong subscribe call. If this video helped you understand Mycoplasma genitalium better, please subscribe to our YouTube channel right now. By subscribing, you support educational content, help spread health awareness, help fight misinformation, help protect future generations. Please subscribe, like, share, and comment. Your support allows us to continue producing high-quality educational content. Thank you for watching. Stay informed, stay safe, stay healthy.